Which moves me nicely to the next thing I want to talk about, which I noticed was some misalignment as well, which is the topic of saturated fat and what the image is portraying and what the guidelines say, because the guidelines did not change from the previous year's recommendations, but yet the visual messaging can be confusing. So I'm sure all of your social media feeds have been full of the saturated fat kind of debate and conversation, because I know mine have. So I would love to hear your opinions on what these guidelines talk about regarding saturated fat.
I mean, much more explicit was that they said less than 10% of your calories from saturated fats. And so that's kind of your guardrail, I guess, if you're gonna debate the proteins and then, having butter, beef, tallow, and all of that, you're still gonna say, well, okay, still less than 10%. And I think that's reasonable because that was very clearly stated. It's not really changed from any time in the future or in the past, excuse me. And then now having these pictures and people saying protein, okay, but still less than 10%. So that again should guide you to say then it's quality. It's the quality of the proteins that you're taking in, and your plant-based proteins are going to have much less fats, saturated fats, and things like that. So I think it, as with anything, it's nuance and it's discussions, and it's okay for people to debate. It allows you to kind of insert in, yes, and this.
I fully agree. And I feel that the way that the food guide, the new pyramid, is set up, it would be truthfully nearly impossible to stay within that less than 10% saturated fat recommendation of as a percentage of your total daily caloric intake. So again, I think from a consumer standpoint, it's not portraying what actually is feasible based on someone's diet, to be able to actually consume a diet like that, that is consuming larger portions and larger quantities of red meat and bone and skin on poultry, and staying within that less than 10% guide, I think would not even be feasible. So that misalignment is definitely concerning.
Yeah.
I think another hot topic that was a little bit spicy on social media was the language around um, liquid fats like butter, beef tallow, and olive oil, and the mention in the text of saying, they are encouraging you're consuming essential fatty acids, but yet don't really mention any of the other type of liquid oils out there. And, there's been some debate as to why, other seed oils weren't mentioned. So I would love your thoughts on what should we be telling our patients when it comes to the guidelines about using butter, beef tallow, and olive oil? And what if they come to us asking about the other options? So I'll mention about the other types of oils. So a really important part of having a healthful dietary intake is variety. Even if we eat, let's say, a healthful food such as, let's say something like salmon. If you ate salmon for breakfast, lunch, and dinner every single day, you're not consuming a healthy dietary pattern, right? We need variety, we need diversity, because all of these different foods are providing different nutrients. So yes, olive oil most certainly is helpful and provides those important essential fatty acids, but it's important to have that variety and getting in different types of fatty acids from different food sources is really important. So I think the kind of the sole focus on olive oil is something that it would be beneficial to provide some more variety in the types of oils, and even just maybe make that category broader rather than just honing in on one specific type of oil there.
Yeah, I think I mean, this is like, as a researcher, writing protocols. You can write yourself into a corner if you're too specific, and then also cause some problems if you're too general as well. But I think here it's okay. On the one hand, they were a little bit specific, but just omitting some of those doesn't mean that they're excluded. So I think that's important. Again, when you have an 11-page document versus 150, how can you add all the things? But if you add all the things, then you have a 100+ page document. So I think that's important. The omission of specific examples did not mean that they were excluded. And I kind of wanted, one of the things that I was thinking about as preparing for this is thinking of what, we have this food pyramid example, but one of the things that intrigued me was, well, what is a meal that would that give you protein, but blew past the 10%? Let's just say if you're 2,000 calories in a day, and just like one ribeye steak, a cheeseburger with cheese, and separately would would just blow past. I mean, that was it. That would be the only thing you could eat that day. And those that are ribeye steak guys are like, oh, great, I can, have one a day. But that excludes anything else in the day. And then cheeseburger, two, tablespoons of butter on a pastry. So it's just kind of, it's like interesting to me that we give these, but there's no way to provide all the examples. And so that's where we can do the nuance in the discussion. And I think it's healthy to have these debates, but they have to use, like, you actually have to be science-based. And we can, I guess I can debate flat earthers, but why? So I think it's important that if someone is stuck, they're stuck, and I can't help that. But for us, it's to provide those examples and those, healthy ways to utilize the guidelines as they're set.
Yet I think you said that perfectly, that there has to be nuance, and that's where that personalized nutrition and honestly personalized medicine comes in. I'm sure you see it all the time in cardiology. One patient can consume a very high saturated fat diet and their LDLs go down, whereas you have another patient and they do the same diet, right? High fat, high protein diet, and their LDLs are skyrocketing into
Yeah.
scary numbers, right? So that's where, again, as the clinician, you need to treat that one patient in front of you and not give broad guidelines and monitor them very closely. Would you agree?
Yeah. Well, I mean, so Catherine brought up the gut microbiome. It's different from person to person, but just
Mhm.
you absolutely highlight it. I mean, we have these, low carb, high fat type diets, and that was for a while there. I was getting referrals from my, clinician community. They're like, this gal has familial hypercholesterolemia, and I would sit down and like, what are you eating? And, sure enough, they were trying to lose weight. It was their diet to lose weight. And so they went low carb, high fat, and a prior LDL cholesterol was like 80. And then suddenly it's 300. And it doesn't happen to everyone, but it happens to a few. And so I think acknowledging that, again, whole foods, eating things, that's why it's so generalized, but within parameters, is recognizing that we're different and we respond to foods differently.